Hello friends, today we'll see what is ultrasound coding guidance and what is CPT code 76937 is used for, and why it is important for coding vascular procedure, this CPT code. There are two CPT codes for ultrasound guidance, that is 76937 and 76942. So for initial one, 76937 is used for coding only for vascular procedure which are done for arteries and vein and on blood vessels, and 76942 is exclusive for non-vascular, that is ultrasound guidance for needle placement, that is for biopsy, aspiration, injection, localization devices. So all these procedures needs any guidance for ultrasound guidance means we will use 76942. For ultrasound guidance for vascular access requiring ultrasound evaluation of potential access site, documentation of selected vessel patency, concurrent real-time ultrasound visualization of vascular needle entry with permanent recording and reporting. So this CPT is 76937 is purely for vascular procedures and will be used only for procedures which are done on arteries, veins, or any blood vessels. So let us see what is the documentation required for coding 76937. So actually three things we will see for coding ultrasound guidance CPT code 76937, that is the entry in the vein under real-time ultrasound guidance, then the patency of the blood vessels, and the images should be recorded. So these three things should be there. So this report you can see here, I can see the access has been taken in right internal jugular vein, which is the central venous access site, but here you can't get any all the three criteria which required for coding ultrasound guidance. Only they have mentioned ultrasound guidance and they have not recorded the images, and they have not mentioned the patency of the blood vessels. So you can read the report fully here. This is for 36561, insertion of tunnel centrally inserted central venous device with subcutaneous port. Here they have done fluoroscopic guidance. Under fluoroscopic guidance they have mentioned, so we have coded the fluoroscopic guidance code 77001. And one thing which I have highlighted below, the common site for central venous access is you will get mostly these three veins: internal jugular vein, subclavian vein, and common femoral vein. Using the access through this site, they will place the central venous catheter. So here they have not given all the three criteria, so we are now coded 76937. So we'll see how they will mention these three things. So this is another report. See here they have mentioned all the three things in one line only. See under ultrasound guidance with the recorded ultrasound image of the patent vessel blood. So they have clearly told here 76937 is used and all the three criteria are met in this report. There is also PICC placement, I think peripherally inserted central venous catheter. So this is also vascular procedure only, but here they have mentioned clearly all the three criteria. But here we have not coded 76937 because you can see in the description of this report, the CPT code, which says it includes all imaging guidance, imaging documentation, and all associated radiological supervision and interpretation required to perform the insertion. So it includes all the procedures required for imaging guidance and radiological SNI. So only one code has bundled all the procedure codes, so no need to code imaging guidance. This report is only to show how the documentation is given for coding ultrasound guidance 76937. Thus some CPTs it is not included, so you can code it separately, but the documentation should be like these three things should be documented: ultrasound guidance, patency of blood vessels, and the images has been stored or recorded. And here you can see common site for PICC access, that is peripherally inserted central venous catheter, is basilic vein, brachial vein, cephalic vein, or medial cubitical vein. So these are the main access site to place the catheter for PICC line placement. The codes which include these 76937, many codes are there. I'm just taken 2 codes here to make you understand. You should not use 76937 code with these codes because it is bundled in the these codes. So when it is included, you cannot quote CPT code 76937. So here you can see 736836 and 36572. In their description it says everything is included, all vascular access, imaging guidance, and radiological supervision and interpretation. Same for say 36572. So no need to quote 76937 when it is included in vascular procedures. So this is the way you can find out when to quote 76937 and how to find what is included in our procedure or not. So hope you have liked this video. Do share it if you like it, and do subscribe to my channel to get more info about medical coding. Thank you.